Your pet's health matters, and sometimes a regular vet just isn't enough. You might need a specialist. Dr. Ryan Gallagher is veterinary neurologist with Nexus Veterinary Specialists, and he joins us now. How are you?
Good, thank you. How are
I'm
you?
happy to have you here. I'm doing well. Describe to us what a veterinary neurologist actually does.
Yeah, so a veterinary neurologist is a veterinarian, obviously,
Yes.
who has received advanced training in diagnosing and treating problems involving the nervous system. So
Okay.
what that involves is potentially problems involving either the brain, the spinal cord, peripheral nerves, so this whole host of issues.
And we do see that a lot with our, our aging dogs. We love them, but we see these things. Tell us a little bit about some of the cases and the services that your practice actually offers to help patients like us and our furry loved ones.
Yeah, so it's quite varied. Just because the signs that we see can vary quite a bit depending on what area of the nervous system's affected. What we tend to see very commonly is problems involving the spine, so either things like, herniated, intervertebral discs, things like, tumors involving the spine, stroke-like events, likewise, problems involving the brain, like epilepsy, so there's quite a few issues.
So how do we recognize a neurologic issue with pets, and then how do we know when it's advanced enough or significant enough to actually seek help with the specialist?
Yeah, that's a really good question. I would say take home is if you have concerns, always check in with your veterinarian first. But sort of hallmarks or signs that you might be dealing with a problem involving the nervous system. Depending on the area, because the signs can vary quite a bit, it might deal with more of a mobility issue, so if your pet is having coordination issues, weakness, seeming like they just don't quite know where their feet are at, that is a big red flag, for a neurological issue. Sometimes it can manifest very similar to an orthopedic issue. It might be really just a reduced weight bearing lameness or seeming painful. Any of those you probably want to check in. Some of them can be very overtly, neurologic. So of course, if your patient is having, pet, I should say, is having seizures, if they're having, convulsions, things like that, that is one that we definitely want to get in. Even if it's as subtle as a behavior change, really you're seeing that your pet is starting to, have some changes in personality, loss of potty training habits, if they're starting to do compulsive behaviors like, pacing or circling, any of those might actually be signs that we've got a neurological issue.
So really just pay attention to your pet the way that you pay attention to all of the humans in your household. If your humans were displaying this sort of behavior, you would sound the alarm.
Yes, absolutely. And that is one thing I think people always want to make sure that they're paying attention to, is that it's not always just that we're slowing down, as we get older. It might actually indicate a deeper issue. So if something's different, it might be worth getting checked out.
I just love that you guys are here just because you specialize in these really significant issues that our pets can face. Tell us again how our pet owners can get in touch with the practice. What's the website again?
Yeah, so it is nexusvet.com.
Okay.
Is probably the easiest way, for our online patient portal. If you have checked in with your primary vet, it's always very easy to have them facilitate a referral.
Absolutely, a recommendation as well. Thank you so much for being with us, Dr. Gallagher. We appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.